Hi, this is Despina, an MHPSS delegate with Danish Red Cross. And we all know that during COVID-19, many are in distress, and staff and volunteers need to be able to calm a person or a family in distress. There are some useful techniques to calm a person in distress that can be used in remote psychological first aid. I'm here today with Pernille Hansen, who is a psychosocial support and protection delegate working for the Psychosocial Center, the Psychosocial Reference Center of the IFRC. Pernille has been working on developing an online psychological first aid material. If you haven't heard the podcast where Pernille talks about the psychological first aid and the new material, I would really strongly recommend you listen to this. So, hi, Pernille.
Hi, Despina. It's great to be here with you today.
Yes, I'm happy to. Let me start, Pernille, by asking you what are some of the tools that the psychological first aid provider can use to calm someone in distress who is calling in on a hotline?
Okay, thanks for that question. Despina, when people are in shock or in crisis, they often have strong physical and psychological reactions, and they may feel confused or overwhelmed, and they may have physical reactions like shaking or trembling or difficulty in breathing or increased heart rate. So the first skill that a PFA provider uses is first to identify what the reactions are and to find out whether the person is experiencing a physical reaction that could have other causes, or whether it's an emotional reaction to something that they're experiencing. So I would say the first skill that the helper uses is being able to identify symptoms of distress. Mm-hmm. And when we do that over a phone call, that's obviously different than when we're with someone in person, because we can't see them face to face, and we won't be able to see their physical appearance or their behavior. Identifying symptoms of distress on a phone call involve paying attention, very careful attention to what a person is saying, but also to their speech and to the tone and the speed of their speech and the strength of their voice. So, for example, if someone is speaking very slowly or very fast, that could be that they're in a sign that they're in distress, or if they're shouting or speaking so softly you can hardly hear them. Yeah. Another is, okay, go ahead.
No, it's just because this leads me to my other question, because sometimes seriously we face callers who are so upset that it is really difficult for us to understand what they are saying. So what do you think we should do as a psychological first aid provider to manage that, so we can understand them better?
If there's in so much distress that it's difficult to understand them, I would take the lead in the conversation, and I would say, for example, I can hear you're very upset and finding it difficult to talk. We can wait a little while you get some time to feel calmer and you're more able to talk with me. Can you, for example, tell me where you are right now? Are you inside or outside? I would ask the person maybe to focus on their surroundings or what they're experiencing, to bring the focus a little away from what's upsetting them and to help them calm down a little.
So you're saying we take the lead and we acknowledge what we hear or what we notice during the conversation, as you said, like they are in stress and it's difficult for them to communicate.
Yeah, and also remind the person that you're there to help them, mm-hmm. and that you really want to hear what's happening. So it's important that they first try to calm down so that you can have a conversation with them. If someone is in so much distress that they really are not able to talk, what you can do is ask, is there someone else around that perhaps you can pass the phone to? Is there someone else near you that I can speak to who can maybe tell me a little bit about what you're going through?
Excellent. And do you think, like you have been also mentioning some of the things that calm people down, is there anything else that occurs or comes to your mind how we can calm them down? You said we can ask them to explain their surrounding, we ask for someone else in the room. So can you think of other ways of calming people down?
I would say the most important thing is for you as a helper to remain calm yourself, because it doesn't help another person who's in a state of panic if you are also panicking. So first, it's important the helper remains calm. Then to always try to use a calm and a soft voice. That immediately has a calming effect on someone else. So if they're panicking, but you speak with them calmly and softly. And then you mentioned also, Despina, show empathy and understanding that they're having a really difficult time right now, and acknowledge that. And tell them, for example, that you're happy they've reached out for help, and that you'll do everything you can to try and help them as much as possible. If they're still unable to calm down, I would recommend that you guide them through a breathing exercise or what we call grounding technique.
Can you explain to me like how to do or when to do the breathing exercise? Like, do we jump into like let's breathe together, or there is a way how we can introduce it to our callers?
Sure, that's a really important question, because the first thing, if someone is having trouble breathing, the first thing you need to do is rule out that it's a medical emergency. Remember that shortness of breath can also be caused by a physical problem, such as a heart attack or an asthma attack. So the first thing is to ask the person, are you having, do you have problems with asthma? Can you tell me are you having any other physical symptoms? And if you suspect that this may be a medical emergency, then it's important that you address that. Rather than instead of jumping into a guided breathing exercise, but try instead and find a way to get medical help to them immediately. Another important thing also to do before you start a breathing exercise is assess if the person is in danger. Are they in a place where they're safe? Is it okay for them to talk? If they are calling and they're in immediate danger, for example, in a situation where someone is threatening them, or they're in a dangerous physical situation, then you have to also attend to that rather than doing a breathing exercise. But let's say you've established they're not in danger, they're not having a heart attack, but this is a typical reaction to emotional distress. Then you can start a guided breathing exercise.
From my experience, I've been noticing that also like calling people by their name helps them to connect with you and with the moment, and even helps in calming them down. Do you think it's true?
For sure. If you say someone's name, it also shows them that you're paying attention to them, and it shows them that you were listening when they first mentioned their name. So saying their name is a really good thing. I think, Despina, the key thing is to remember not to panic yourself. So if someone else is panicking, it's contagious. That you are calm will naturally also help to calm the other person down. A very simple breathing exercise is to ask someone that you're speaking with to put their hands on their belly and to pay attention to their breath. And when they breathe in, can they feel the breath in their belly? Because when we panic, most of us breathe into our chest, and we don't actually pull the breath deep down into our lungs so that our belly moves. So if you ask someone to put their hands on their belly, and as they breathe in, ask them to feel the breath coming all the way into the bottom of their belly, and that their belly expands. And sit and do this breathing exercise with the person for a few breaths until you can hear on the other end of the call that now their breathing has calmed down.
Excellent. Thank you so much, Pernille. Before we end our conversation today, is there anything you would like to add to our listeners, or you want them a last tip that you want to give the helpers? Is there anything that is on your mind?
No, I think the most important is to keep calm, and to always also have a backup person, that if you encounter someone who's in such a severe state of distress that you're very concerned and you feel like you don't know how to manage it, have someone that you can refer them to, or someone that you can call afterwards to get some advice on how to handle it, so that you don't panic yourself because of the situation.
Excellent. Thank you so much, Pernille, and thank you for having this podcast with us. And I wish you a lovely day.
Great. Thank you so much. Bye.
Bye.